am Miss Lori, lead phlebotomy instructor at PMI Phoenix. I'm going over Chapter 7 of the Phlebotomy Essentials, 7th edition by Ruth McCall. This is a long chapter, so I'm going to jump right in. So starting on page 184, what you need to know is you need to be able to pick your equipment out. Besides finding the vein, you need to decide what type of needle, what size of needle, and what type of tube collection device. Maybe you need to do a syringe, but you need to be able to pick all of that out for each patient. So we're going to start with equipment. First is going to be your blood draw station. Most phlebotomists are going to be working in a draw chair. They have examples on page 184. They are adjustable, so the armrests will go up and down. Sometimes they'll go side to side to allow for overweight patients. So know how to adjust your chair. Ours have a small drawer that you can put supplies in. Sometimes they won't, so you'll have a like a cart next to your station. Just depends on what your site provides. Sometimes the chair will recline, so if a patient is prone to fainting, we want them to lie down. Sometimes a chair will accommodate that, otherwise you need an exam table. Next is your carriers. So I've got some examples of some carriers. This one's pretty small. This one's a little bit larger, and it has a drawer on it for the supplies. Sometimes you'll have a big cart. Usually in the hospital you're going to have a cart. So doctor's office, you may have a small carrier to put supplies in so you can go to the patient's exam room to do a draw. Again, just depends on your site. You will stock it as you need supplies. So as you see fit, stock your cart or tray. Make sure that you have enough supplies, especially if you're in the hospital, to be able to make rounds and not have to keep going back to the lab for supplies. All right, next is glove and glove liners. I never saw glove liners until I actually started teaching, and somebody brought these into me. So I don't even know how they handle these as far as washing, reusing. So, but here they are. You would wear these underneath gloves, but otherwise you have to wear gloves with every patient. That is CDC and HCPAC. Standard precautions, OSHA regulation, you have to wear 2 gloves, make sure they're complete and they're not torn. New pair for each patient, and also if you're doing different procedures. So if you're doing a throat swab and then a blood collection, you want different gloves for each procedure. Gloves are non-sterile, they come in a big box. So if you need sterile gloves, those are available where they're individually packaged, but for our purposes, they are non-sterile. But you don't want to over-contaminate them, so try not to touch a whole bunch of stuff and then touch your patient, all right? Make sure that you decontaminate your hands after you take your gloves off. Don't assume that your gloves are perfect, because they're not. They could have tiny little holes, and so you can get contamination. Make sure you sanitize if your hands are not visibly soiled. Sanitize. If they are visibly soiled, then you're going to wash your hands. All right. Next is antiseptic. So we have different types of antiseptic. You can see those there. Individually packaged. These are for use on the skin. These help inhibit growth and development of microorganisms. They don't necessarily kill them, so they don't sterilize a site, they just clean a site. Most common is 70% isopropyl alcohol. Ours look like that. Open it up for each patient. You may have to use multiple alcohol wipes depending on how dirty the patient's skin is. The one you're going to use for blood culture collection is going to be chlorhexidine. This is a wipe. There's also a swab that you can use, or a little scrubber. Next is a disinfectant. This is not safe for human skin. This is for surfaces. Ours are the purple Sani wipes. Surfaces only. Wear gloves when you clean with Sani wipes. You're cleaning up potentially body fluids. You don't want to do that without gloves on. Also, this is a very strong cleanser, so wear gloves. You can also do a bleach solution, 1 to 10 bleach. We use Sani wipes. Next is hand sanitizer. They have pictures on 187 if you've never seen hand sanitizer before. So CDC recommends alcohol-based hand sanitizers. It is not a substitute for hand washing if your hands are visibly contaminated, so only if there's no visible contamination. Next is gauze pads. So we're on 188. This is a 2x2 gauze pad. This is actually 2 of them. We're gonna use these to hold pressure on a site after we've done a blood draw, so we'll fold it into quarters, put it on the site. We don't recommend using cotton balls because either the cotton can get caught in the platelet plug, or when you pull the cotton ball off, it can pull that platelet plug out. So gauze is recommended. Bandages, we've got a couple different options. Most sites you're going to use paper tape. People are allergic to paper tape. So if they say they are allergic, occasionally your site will have Coban. You can use that. Band-Aids are a good option. Ask them if you can use a Band-Aid instead. But otherwise, if they're allergic to everything, you don't have Coban, then you may just have to hold pressure until they stop bleeding and then let them go without a bandage. All right, we're not using any type of bandage on a child under 2 years old. It's a choking hazard, so we want to make sure that we are not responsible for them choking. You can offer the parent the bandage at the end of the procedure. Baby stops bleeding. We tell the parent, I can give you a bandage if you'd like to apply it, but we can't apply it because it is a choking hazard. All right. Next is a sharps container. This is a small one for capillary supplies. Hard side, it's got a biohazard logo on it. It has a fill level. You don't want to fill it past that level. It has a locking top on it, so once you close this with the locks, you cannot open it again. Needles go in sharps. Any tubes that were used that need to be discarded of, any type of supplies that have body fluids. So pipettes, which is this, that you're transferring specimen with, would go in a sharps container. Next is a biohazard bag. This is an example of a biohazard bag. Has to have the biohazard symbol on it. It has a pocket that has a zippered closure. That's what we put our specimen in. There's also a pocket in the back, and that's for paperwork. Only use this for biohazards. Slides, you're generally not going to need a slide. So we don't make slides. If you ever work in the lab itself, they may train you on using slides. Next is a pen. Carry a pen. I suggest get a fine tip Sharpie. Writes on everything, doesn't smear. Just make sure that you keep it near and dear because people are going to ask to borrow it and they're going to disappear. So keep your Sharpie with you. A watch. So your site will let you know if you can wear smartwatches. Maybe you have to keep it on airplane mode. So ask them. You will probably just want to get some cheap Walmart $10 watch that if it breaks when you're at work, you can go buy a new one and it's not a big deal. Better to ruin a $10 watch than a $300 or $400 watch, right? Patient identification equipment. There are bracelets that have RFID, so it tracks the patient. That's what you need to know for that. Vein locating devices, I don't have one to show you. I know the VA has one. Some sites do offer those. not for you to use every day with every patient. This is if you have a really hard stick and you cannot find a vein on them. So it's transillumination, it's an LED, and you hold it against the skin, it lights up, and the veins are very dark so you can see where they are. Doesn't show you how deep they are, just shows you that they're there. All right, there's an app you can get on your phone that's called VeinSeek Pro, and that will work with your camera. It's not the best. It works good for superficial veins that you may not be able to see, but it's an option. So, and it's like $10. Next is a tourniquet. You guys will get a tourniquet. This is a disposable strap tourniquet. Your supplies are 99% non-latex. So these don't have latex in them. They're just a rubber tourniquet. We use these to compress the area above the venipuncture site. It restricts blood flow, fills up those veins, helps the veins to puff up so that we can find them and we can do our stick more easily. All right? And it doesn't restrict arterial flow, so we don't want it too tight. We want it just tight enough. Tourniquets should stay on a minute and not anymore. The tourniquet should be easy to release. So you're going to apply your tourniquet in a way that you can just pop it off very easily. There's also tourniquets like this that has a little buckle on it. So it just pops in like that. And then it has a button. This one sticks to release it. There we go. And it's stretchy. So there's different tourniquets. These are disposable, so potentially some sites have you use one tourniquet and you throw it away for every patient. If you reuse this, you want to make sure you still clean it in between the patients. If you get blood on it, if you drop it on the floor, then that goes in the garbage and you get a new one. Some sites will use a blood pressure cuff in place of a tourniquet. I know blood donation centers may use cuffs instead of tourniquets, so it depends on the site. Next, we're going to talk about needles. So, phlebotomy needles are sterile, they are disposable, and they're designed for single use. So, we are never using this needle more than once. We've got multi-sample, we have hypodermic, which I'll show you in a minute, and we have butterfly, which I will also show you in a minute. Butterfly is also called winged infusion set. Make sure you examine packaging. So a multi-sample comes like this. I want to check to make sure that the sticker is intact, there's no tears. Packaging for butterfly, I want to make sure it's all intact. Again, no tears or anything. If there are, then I'm going to dispose of that needle and get a new one. The end that pierces the vein of your needle is called the bevel. It's going to be hard to see because of the camera. So every needle has a bevel. You want to make sure that it has a nice beveled edge. If it's flat, then there was a problem in manufacturing. You want to discard it, get a new one. Whenever you uncap the needle, you are checking it for defects. The long cylindrical portion is called the shaft, and then the end that attaches to the blood collection device is called the hub. So that would be this end down here. That's the hub. This is another needle. There's a sheath over it. If I pull back on that sheath, you'll see there's another needle underneath it. The internal space of the needle is called the lumen, just like the interior space of the vessels. Needle gauge is colored. So this is a 21 gauge, the green. This is going to be larger. Black is 22 gauge, that's a little bit smaller. Our next size down is 23, that is the light blue butterfly. So these are the three most common sizes in phlebotomy. If you go into blood donation, they're going to use larger needles, so 16, 18 gauge, but for us, for blood collection, for testing, 21, 22, and 23 gauge. It also says it on the sticker, on the label, it'll say the size of the needle. Make sure you know the size and you know the color association. 21 gauge is the standard. We should use that on most of our patients unless their veins are a little small. If you're using a hand vein, then you're going to adjust your needle accordingly. If you use too large of a needle, you're going to damage their vein. If you use too small of a needle, then it won't injure the patient, but it's going to hemolyze the blood. So as the blood is being forced through a very small opening, it's going to tear apart those red cells and it's going to ruin your specimen. The length of the needle is different depending on which needle you're using. So with a multi-sample, it's a longer needle. Butterfly is a shorter needle. Patients think that these are better because they're smaller. Not necessarily. It depends. I could put a 21 gauge into a patient's vein and it's not going to hurt. If I'm not doing my draw correctly, I could use a butterfly and it could hurt. So it's not necessarily the size of the vein, it's how good the phlebotomist is. Also, we're only putting a small amount of this needle into the vein where we are putting the entire length of this needle into their vein. Safety features, all needles need to have a safety feature on it. This one is the tube holder has a safety feature. And for these multi-samples, the tube holder does not, so the needle has to have the safety feature. All right, all of our needles need to have safeties on them. If they don't have a safety, we should not be using that needle. And you should always stay behind the safety, away from the needle when you are closing it. So when I uncap and I inspect and I do my draw, when I take that needle out, I should just close it very easily and then dispose of it as one unit. I'm not taking these apart for a multi-sample. Leave it together. And that is, OSHA regulation is that either the needle or the tube holder has to have a safety on it, has to. Most common, efficient, and CLSI preferred system is evacuated tube system. So again, something like a multi-sample. Once I put my tube on, then I have evacuated tube system. The blood comes into the needle and it goes directly into the tube. It fills, I take the tube off, and then I can dispose of this as one unit. I can collect multiple tubes with evacuated tube system. That is the advantage of it. Syringe, you have to do some math and you need to figure out how big of a syringe do I need for the tubes that I need to collect to send out. Where evacuated tube system, I can put tubes on all day. Multi-sample needle, again, I showed that to you. Make sure it has the safety feature on it. Tube holder, some of them look a little bit different depending on the brand, but they fit a tube inside of it. OSHA regulation is that you leave the tube holder on the needle when you dispose of it. Dispose of it all together. Evacuated tubes are used with ETS and syringe draws, so we're putting blood into a tube to send it into the lab. Tube selection is based on the age of the patient, the amount of blood needed for the test, and the size and condition of the patient's veins. So, let me give you two examples. Most common for chemistry is Tiger Top. It's a pretty big tube. All right, if I'm using a small needle, somebody that has delicate veins, I want to use a smaller tube. With Tiger, the smaller size is a Gold Top. Don't know why they changed the color, but they did. So this has a smaller vacuum in it that's going to be more gentle on their veins. I could go even smaller and do this short draw SST tube. So there's different size tubes depending on what you need to do your draw for your patient. All the tubes have vacuums in them, so that's going to pull the blood into the tube. It will stop when it's full. When the vacuum is exhausted, it will stop. So we're going to leave the tube on the needle in the tube holder until it's completely filled. Then we're going to take it off and we're going to do inversions, and that's going to mix our additive in it. There are short draw tubes, so if you notice, I've got a light blue that is regular and one that's frosted, so there's a clear covering on it. This is a short draw tube, so it's not going to fill as much as this tube would. Less vacuum, we're not taking as much specimen. I also have it for lavender. So we've got the lighter color and the darker color. Lighter color is short draw, does not fill as much, easier on the patient. Additive is any substance placed within the tube other than the tube stopper, or if the tube is glass, the silicone coating. Additives are listed on the label, also color coded. So this is a pink, this is EDTA for blood bank. You're gonna have to learn order of draw, additive, and tube color, and also departments. So a lot of memorization on your equipment. If the additive prevents clotting, it's going to leave you a whole blood specimen. I can let it sit all day, pick it up, invert it, and it's still going to be whole blood. If I spin it, then I am going to separate the cells out and be left with plasma. And the additive is an anticoagulant, does not clot. If the specimen does clot, it's a coagulant tube, and when it's spun down, you are left with serum on the top. There are some non-additive tubes. They show the white and black top on page 197. There is also red glass that does not have an additive. That's what you would see at most of your sites if they have a non-additive tube, is red glass. Again, stoppers tell you what additive is in your tube. So start learning your colors. There's a chart on page 199. There's also a couple in the back of your book that give you really good information about putting those together. There's games in the Blackboard resources section to help you put those together. All tubes have expiration dates printed on them. Make sure that you look at them. If there's tubes that you don't use very often, you need to be checking them once or twice a month for expiration. If you use an expiration or a tube that's expired, the lab will reject it. So don't even bother sending it in. If you notice after you drew it that it was expired, you're going to need to recollect it. So it's going to affect the additive. It's also going to start losing suction with the vacuum. Syringe system, we have 3 parts. So let me show you. We've got these 3 parts for a syringe. The needle is called a hypodermic needle. It is just for syringes. So I open it up, it's individually packaged. I open up my syringe and I put these together, twist until it's snug. Now I have my needle ready. I want to check the plunger, make sure it moves, because there's rubber there. These come in different sizes, so you would need a syringe size for how much blood you are collecting. All right, barrel is the outside of the syringe, and this is the plunger that you move. Know the parts of a syringe. Volume is selected according to size and condition of the patient's vein and amount of blood to be collected. There's also different size needles. In class, you're going to use 23 gauge, so the same as a light blue butterfly. They're going to have delicate veins to need a syringe, so you want a small needle, preferably. All right, know that there's 2 parts to the syringe. Once we collect blood, So if you look at this one, I'm going to open it. The safety is the folded part right here. So I'm going to do my draw, stay behind the safety, and for this one I'm going to flick it, and that will cover up the needle. Once I have blood in here, how do I get it out and into a tube? I'm going to use my transfer device, syringe transfer device, twist my needle off, the needle gets thrown away. Now I'm going to take my transfer device, twist it on. Now I can put my tube in, and it's going to, the vacuum's going to suction the blood out of the syringe into the tube. Do my inversions, label it, and send it to the lab. If I have multiple tubes, I put one tube on. When that's full, I take it off. I put my next tube on, do my inversions, and I can do that for however much blood I have and however much I'm putting into each tube. When I take the tube off, the suction is gone with the tube, so it's going to stop, and it will stay there until I put the next tube on. I want to make sure I transfer the blood out as soon as possible because there's no additive in here, so it's going to start clotting relatively quickly, so transfer it out. Never push on a syringe plunger. So once I've got blood in here, I never want to push on it. If it is not suctioning, then I'm going to try putting a different tube on. It's probably the tube, but it should suction and pull that blood out, which is going to pull the stopper or the plunger down on its own. If I push on it, I'm going to hemolyze that blood by forcing it through that needle. I also want to make sure when it's in the patient's vein that I never push on the plunger because I could be pushing air into their vein. Make sure when you are filling your tubes, you're holding this upright. So I put the transfer device on, turn it upright, and then put my tube in. Let gravity help with taking that blood out. Also, you don't want to cross-contaminate and get blood on that internal needle in there. So hold it upright. Next is your winged infusion set or butterfly. Individually packaged, you're going to open it up, put your tube holder on. This is an ETS device. So I've got my needle here, my tube holder over here. Usually we use these for hand veins. So we want a nice flat angle, very small needle. The wings make it a butterfly. That's why they call it that. And the wings help us to hold that flat angle. If I were to hold it here, then I would be holding it at more of an angle and I would probably go through the vein. So we use those wings to help us get the proper angle of the needle. Small, difficult veins, we're going to use a butterfly. Elderly patients, pediatric patients, we want the 23 gauge butterfly. There is also a 21 gauge, which is the same as our green multi-sample, so it's the larger needle. Some sites have these, some don't. There are patients that request a butterfly even if they don't need it for antecubital. You can use the 21 gauge for that. But hand, you want to use the smaller 23 gauge. We can also use a butterfly for a syringe. So what I would do is when I take the butterfly out of the packaging, I'm going to take this needle off and then I'm going to dispose of it, and I can put my butterfly onto the syringe and collect it right from that. So I can do both ETS and syringe with a butterfly. If I'm collecting a light blue tube with a butterfly, there's a lot of air in the tubing. So if you look at it, put it back on ETS, there's a good amount of air when I first get started with the butterfly. So what I want to do is, because the light blue has to be filled completely, I'm going to take two light blue tubes. I'm going to put the first one on, I'm going to let the blood go through the tubing. As soon as I get blood in this tube, I'm going to take it out. I'm going to dispose of it. I'm going to take a new light blue tube, put it on, let that one fill. It will fill completely. And that's called a discard tube. That's only for our coagulation. Combination sets, they show a picture on page 203. I haven't seen them. I don't have an example to show you, but just know that they are out there. If your site uses them, they will train you on that. Don't mix tubes. This is in the caution box. So let's say I cannot fill this light blue completely. I take another light blue tube. I fill that one partially. I'm not going to pop the tops and mix them together. You never want to do that. You'll have the right amount of blood, but you'll have double the amount of additive. So please don't do that. You want to try with another tube, see if you can get that one filled all the way. As soon as your tube comes off of the tube holder, you want to do inversions, and it looks like this. You're not going to shake it. You're going to just gently back and forth. And that is 3 to 8 times depending on the additive. We're going to talk about tubes now. Anticoagulants prevent the blood from clotting. So that's going to leave either whole blood, or I can spin it down and have plasma left over. What the anticoagulant does is it binds or precipitates calcium or inhibits the formation of thrombin. If we need whole blood or plasma, then we want some type of anticoagulant tube. First one on the list is EDTA, which is your lavender top. Most common. Do you want to know how to say it? Ethylene diamine tetraacetic acid. You're never going to have to say that. We call it EDTA. Use your abbreviations. So, my EDTA, these are all lavender. I have my short draw in the middle. These are just 2 different company. I have my pink top. I have my tan top. That's also EDTA. And I have my pearl top. All of these are an EDTA additive. You do not need to know if it's K2 or K3 EDTA. Just know that there's EDTA in here. All right. These are for blood bank is the pink. Hematology is your lavender. These bind calcium. So know that EDTA binds calcium. And we're doing 8 to 10 inversions with EDTA tubes. Next is citrate. Most common is your light blue, and this is the short draw, the frosted. This also binds calcium. These are for coagulation tests, so for clotting. 3 to 4 inversions for this. You have to fill this tube completely, so it needs a 9-to-1 ratio of blood to anticoagulant. If it is not full, the lab is not going to take it, so fill it completely. Another citrate tube they'll talk about. I'm going to skip. Next is heparin. So heparin is going to be our green tops. So I've got these 2. I've got these 2. You notice we've got some larger size, some smaller size. So heparin inhibits thrombin. This is the one that inhibits thrombin. This is for stat chemistry. So if you're especially in the hospital, you're going to do a ton of green tops. So stat chemistry. Not so much outside of the hospital. There are a few tests that take heparin, but otherwise stat. All right. There are 3 different types of heparin. There's lithium, sodium, and ammonium heparin. You have to read the label to see which heparin it is. All right. The only designation with our heparins is the light green has gel in it, and the dark green does not have gel. So one has gel and one does not. And we're doing 5 to 10 inversions. We have different heparins because the different tests require it. If I'm doing a lithium test, I don't want to use lithium heparin because I'm now testing for something that's already in the tube. So I would use a different formulation. Next is oxalate. This binds calcium. This is in the gray stopper. Potassium oxalate is your most common, 8 to 10 inversions. This is a common tube for glucose testing, blood alcohol level, and lactic acid is your gray stopper. Next is ACD, acid citrate dextrose. So this is another citrate tube. There are two different solutions. So there's solution A and solution B, different sizes. This is a yellow top. It is not a gold top, so don't confuse them. If you're unsure, read your label. Okay, so this is for immunohematology testing, DNA. So this is a common DNA tube. Also HLA, this is for transplant compatibility. So for bone marrow and cord blood transplant. 8 inversions for our yellow top. Don't worry about CPD. Next is SPS. That is also a yellow top, so make sure that you read your label. SPS is just for blood cultures. So this is an alternative to a blood culture bottle. Most sites don't like the tube. They'd rather you just put it in the bottle, but you do need to learn this. 8 inversions for our yellow SPS tube. Next is anti-glycolytic agent. So this prevents glycolysis, and that is going to also be in our gray stopper. So we have potassium oxalate and sodium fluoride in this one. And the sodium fluoride is just to prevent glycolysis. All right, gray stopper, again, 5 to 10 inversions for that one. Next is clot activators. This enhances coagulation, which is clotting in our tubes. We want it to clot. We put the clot activator in there to help it clot faster, basically. We have our serum separator tube, which is your tiger top. That has gel in it. And we also have a red top that does not have gel. So they both have clot activator. One has gel, one does not. Kind of like your heparins. So most of these specimens clot in about 30 to 45 minutes, 30 to 60 minutes. There's also a rapid serum tube, which is the orange top. I've never seen it, but they have it in the book. Know that the rapid serum is orange. It clots within 5 minutes. I call it the unicorn because, again, you're never going to see it. But most common is going to be your tiger top and your red top. This is called SST because it makes serum and the gel separates it. Serum separator tube. The gel that is inside of our tubes is called thixotropic gel. So we've got different colors that have the gel within them. The density of the gel is between that of the cells and the serum or plasma. So when it spins in a centrifuge, the cells are the heaviest. They're going to go to the bottom of the tube. The gel is going to liquefy. It's going to sit on top of the cells, and then the serum or plasma will be on top of the gel, and then the gel will reharden. Then last, we have our trace element tubes. So I have 2 of them here. There we go. You can see the colors. Royal blue stopper. They're specially treated to be as free of trace elements as possible. There are 3 potential additives in them. So if you look at the label, this one has a lavender stripe on it. There you go. This one has a red stripe on it. So the lavender would be EDTA. The red would be either clot activator or no additive. And then if I had one with a green stripe, that would have heparin in it. So look at your label to see what the additive is. If I need to do trace element testing, so copper, zinc, lead, I'm going to do that in the trace element free tube. But make sure that you read the label because the stopper color is the same. Order of draw is last, and this is something that you need to figure out how you are going to remember it. This is just a memory thing. Also, with the tubes and the additives and everything in this chapter, memorization. Do flashcards, do anything you can think of. My recommendation for order of draw is to look on Google Photos or Google Images. Find one that you like of order of draw, make it your lock screen on your phone. Every time you pick up your phone, there's the order of draw. There are mnemonics, there's one in your book on page 209. I don't like it. If you like it, use it, or you can find something else that works for you. But order of draw, we want to collect our tubes in a specific order so that those additives do not cross-contaminate or carry over from one tube to the next. So first, we're going to do our blood cultures, either the bottles or the yellow SPS. Some sites actually have you do blood cultures as a separate draw. So they will train you on that. But in our case, it would be first in the order of draw. Light blue is next. Then we have red, tiger top or gold top. Then we have our light green and dark green. And then our lavender, which can also be pearl top, pink top, tan top, any of those EDTAs. And then our gray top is last. So you're not going to draw all these tubes every time on every patient. But whatever tests you do have, you need to figure out what tube does it go in and what is the order of draw for those tubes. Trace element is a special tube. I call it the special snowflake. So that one is, it either needs to be first in the order of draw or by itself. So it depends on what additive you're using and where that additive is in the order of draw. So if it's going to be first, let's say I have the royal blue with the red and I've got a tiger top and a lavender top, this would be the first in the order of draw, so I could draw all of my tubes together. But if it was the lavender stop or the lavender colored tube and I had a tiger top and a lavender, this would not be first, so it should be a separate draw, so it does not get contaminated. So that's our trace element free. They talk about carryover cross-contamination. So what is going to cause that carryover or cross-contamination the most? What's going to happen is I am filling my tube from a draw. There we go, this way. If I'm filling it like this, the tube is filling in this direction, yes? Well, there's a needle there. What's happening is that blood is picking up the additive and it may be leaking back into the needle. That would cause reflux, or if it's just contaminating that needle inside of there, when I put the next tube on, then that previous additive is now inside of this tube. Best thing we can do is, instead of drawing like this, we lower their arm so that the tube is flat, or it's more of an up and down, so the blood's coming in and it's filling this way, all right? So the tube should fill from the bottom up. Tissue thromboplastin, do a clear or discard tube. Microbial contamination, so they're talking about blood cultures again. Blood cultures are either separate, a separate draw, or they are first in the order of draw. We want the site as clean as possible, so we want to do those first. The sites will tell you if they want a separate draw for that one. All right, that's chapter 7, and I'll see you at the next video.